Toxicology made simple. Approach RRSIDEAD Resuscitation Risk Assessment Supportive Care Investigation Decontamination Enhanced Elimination Antidote Disposition or even simple approach, as simple as ABCDEF. ABC, airway, breathing, circulation as per resuscitation, D. Decontamination E. Enhanced elimination F. Find poison and find antidote. Airway. Pay attention to airway injury or edema due to causative injury, aspiration, vomit, CNS depression, complication of treatment with charcoal, breathing. Pay attention that too much oxygen is not good for paraquat or chlorine. Avoid intubation for metabolic cause, especially salicylate poisoning unless other indication. Circulation similar to non-tox patient digoxin. Toxicity cause arrhythmia. Use Digifab shock and calcium channel or beta blocker. Overdose, use high insulin euglycemic therapy. Hypertension and sympathomimetic. Overdose, use benzodiazepine. Disability. Pay attention to seizure in damp, CNS depression environment. PPE. Protect staff patient in damp, temperature control. Identify poison by good history taking and physical examination. Odour, skin condition, pupil size, bowel sound/bladder, tone. Reflex, clonus, to identify toxidrome and toxin. Patient profile such as underlying liver/kidney derangement, toxidrome, sympathomimetic anticholinergic, cholinergic NMS, serotonin, opiate, sedative, hypnotic, supportive care, similar with non-tox patient. Investigation. Bedside test. ECG, blood glucose, EBG, GAPS, anion, lactate, creatine, saturation. Salicylate, paracetamol, insulin, alcohol. Oral hypoglycemia cause low sugar. ECG feature lithium, TCA, digoxin. X-ray. Identify radio opaque, identify complication of poisoning, lung edema, aspiration. Decontamination, surface versus skit. Decon, activated charcoal, further elaborated later. Rarely used lavage, contraindication. Unprotected airway, complication or aspiration, esophageal tear. Enhanced elimination. Multiple dose charcoal. Urinary alkalinization, salicylate, phenobarbital. Extracorporeal drug removal, low molecule, small volume distribution, low protein binding, example diacetyl and alcohol, aspirin, lithium. WBISR prep, BISR, drug packer, contraindication. Ileus, obstruction. Antidote mechanism. Chelator. BALD. Spheroxime, competitive inhibitor, flumazenol. Damp, naloxone, bypass mechanism, NAC, antibody binding, Digibind, antivenom. Reactivating enzyme, oxime, K, protamine antagonism, high insulin euglycemic, atropine. Disposition based on patient outcome, management of psychosocial. Toxidrome. Simplified approach, take it as pinch of salt. Fast versus slow. In fast, depend on tone. Soft, mean no rigidity, stiff, mean rigidity. In soft, skin is dry then it is anticholinergic, skin is wet then it is sympathomimetic or withdrawal of sedative. In stiff, hyperreflexia with clonus then it is serotonin toxicity. If there is hyporeflexia then it is neuroleptic malignant syndrome. In slow, if skin is wet then it is cholinergic toxidrome. If skin is normal, then look at pupil. If there is meiosis, then it is opiate. If there is normal pupil, it is sedative hypnotic such as benzodiazepine or alcohol and so on. Always remember patient may present with mixed toxidrome which will have varied presentation. A drug can act on multiple receptors. Beware of complication of toxin. Indication of activated charcoal. 5T, not for haha. Time mean 1 to 2 hours. Toxin, lethal, e.g. killer C, cyanide, colchicine calcium channel blocker, TCA, salicylate, ton, large ingestion. Tacky, adsorption. Tasty, patient willing to take it. Not for haha. H, hydrocarbon. A, acid or alkali. H, heavy metal. A, alcohol. Dialysable drug for stumble. I, isoniazid. V, valproic. S, salicylate. T, theophylline. U, uremia. M, metformin/methanol. B, barbiturate. L, lithium. E, ethylene glycol. Radiopaque drug atomic number more than 15 resistant to dissolution. Enteric coat, slow release formulation. CHIPS. CHIPS chlorinated hydrocarbon, calcium, crack. Heavy metal. Iodinated compounds. Packet of drug, Plato, potassium, psychotropics, lithium, TCA. Enteric coated, e.g. aspirin. Salicylate, slow release preparation, sodium. Drug amenable to MDAC ABCDEQV aminophyllene/ASA barbiturate carbamazepine dilatin, phenytoin/dapsone quinine valproate. Seizure causing drug Otis Campbell, OP, organophosphate, OHA, oral hypoglycemic agent. TCA, tricyclic antidepressant. Insulin, isoniazid. Sympathomimetic, salicylate. Cocaine Colorado, CN, chlorinate HC, camphor. Anticholinergic. Methoxanthine, methanol. PCP, propranolol. Bupropion, benzodiazepine withdrawal. Edo, alcohol withdrawal, ethylene glycol. Lithium, lidocaine. Lead,